Good day, Franklin County. Welcome to another episode of Talk of the County. I'm your county administrator, Kenneth Wilson. I'm pleased to be here today with our Franklin County Coroner, Dr. Nate Overmire, also known as Dr. Nate. Welcome.
Thank you so much for having me, Administrator Wilson. It's a pleasure.
We are here live we have the laboratory here at the Franklin County Forensic Center. It's feeling like an episode of CSI Live, Franklin County style. But let's get right into the conversation. What is it like to be the Dr. Quincy for Franklin County, to be the Franklin County coroner, and to be the head man in charge of the Franklin County Forensic Science Center itself, which is a state-of-the-art facility, one of the best in the country, modeled after the best one in the country.
Absolutely. We are so privileged and honored to have one of, like you said, the best facilities in the country. Now, Administrator Wilson, are you going to be mad at me if I tell you that I have not seen Dr. Quincy yet, but I promise that I will after this? I've been asked that multiple times. I know who he is, but I haven't seen an episode. And I need to check out this new program called Watson. Have you seen it? Morris Chestnut. He's the doctor and investigator, and I need to watch that. But yes, we're so honored that Franklin County invested in its people, in its county, by granting us this beautiful facility and all the people that work here. Every day is a little different being your Franklin County coroner. Every day we wake up, we start the day at 8 o'clock, having an agenda. We go through the list of decedents that come to our facility, and then it kind of branches off into everyone's specific roles and duties. After we set the agenda, we go through our list. Our pathologists and our morgue technicians are doing autopsies. Our toxicologists in this beautiful lab behind us are running the machines and running through the toxicology evidence. The rest of the staff are communicating with families, with law enforcement. So it's a whole host of roles and duties that we have here.
How many folks work in this office as pathologists, for example?
We're so blessed to have 8 wonderful forensic pathologists, with a 9th coming this summer.
And you have to go to school a really long time to get in this profession. Talk a little bit about the background of a pathologist and the journey they have to take to work in this facility in that capacity.
So forensic pathologists are physicians like myself. We both go to 4 years of medical school, but that's where it starts to separate. Whereas I went to family medicine residency, which is just 3 years, they go to pathology residency, which is 4 years. And then to become a forensic pathologist, they have to go through an additional 1 year of fellowship. So 9 years of schooling and training to do what they do. And actually, one of our pathologists is a neuropathologist. So she went to an additional neuro fellowship. So she does all of our brain cases, which is really great to have a forensic neuropathologist in our facility. So it's a long time of education, training. They are the experts. And not only do they do the autopsies, they have to work with law enforcement. They have to be familiar with those concepts. Then they have to testify often on homicides or motor vehicle accident cases or overdoses. So they have to be familiar with that vernacular, with that those concepts with law enforcement and justice. It's a lot of training.
Okay. I talk about Team Franklin County a lot as administrator. Talk about some of the other entities that you work with each day. You touched on the public safety aspect of the job. What are some of the other partners that people may be surprised to learn that this office works with?
One of our really important agency partners is Franklin County Public Health and Columbus Public Health. We work with Commissioner Mazzola, Commissioner Roberts very often to increase public safety and public awareness on things that are going on in the community, whether it's overdoses. And so we will, if there's a surge of overdoses in one particular, there's a surge of overdoses in Franklin County. And specifically, I mean 5 overdoses within the same 24-hour period. We will notify our public health partners. And if it's in one particular community, we'll tell our partners, hey, you need to, go to the scenes to investigate this further to help prevent this. And so we work with public health on a day-to-day basis. We mentioned law enforcement, so our detectives come into our office to view autopsies so that they can go back to the scene or go back to the office and put those pieces of the puzzle together. We work with other entities like Celebrate One. I'm really passionate about maternal and infant mortality. And when we have our infant mortality rates being as bad in Ohio as they are, I'm really dedicated to getting to the root cause of some of these sudden unexplained infant deaths and working with Celebrate One to lift them up, to give them the data, but also bring awareness to this really important issue. A couple other agencies that we work with heavily are AdamH. That's a huge partner that they provide resources to other county agencies on mental health and addiction. So we're always working with those really important entities. We're working with the African American Male Wellness Agency, talking about Black men's health, whether it's in the barbershop or in schools or other events, to making sure that they're talking about mental health and preventing, anxiety, depression, and ultimately an overdose or suicide in our community. So we're really promoting overall health and well-being in our community.
I think that is part of the job that you seem to bring a lot of energy towards, and that is being part of things such as suicide awareness and things such as bringing attention to the number of preventable overdoses in this community. Normally people would look at your job and say that you are here just for the statutory function of performing autopsies as the law states, to do toxicology work as the law state. But you in this position, you want to do more than just what the law states and reduce the number of deaths in autopsies that you had to perform in. Where does that passion come from? Does it come from being a family care physician and working with families and through up to this point in your career?
Mm-hmm. So as a public servant, I've always wanted to emulate servant leadership. That's the sort of leadership style that I subscribe to. And so that can mean a whole host of things. But ultimately, caring for patients as a family physician and talking about prevention a lot with them in the office. Now I feel like as the coroner, my patient is the community, and I want the community to have holistic care, a holistic approach to the care that they're getting, and ultimately preventing deaths that we're seeing in our community. And so that means working with our partners and other stakeholders to advocate. And as a student, as a resident, and now as an attending physician, I've always been passionate about advocating for better health, better access, better results, and having a greater impact in our community.
So while you spend a lot of time preparing educationally and professionally, looking at the science, looking at facts, you still have a desire to provide the intangibles. I didn't think that the servant leadership would come up in this conversation, but we talked about servant leadership. So if anyone want to read about servant leadership, began with a gentleman named Robert Greenleaf. And that philosophy has stood the test of time. And it's a form of leadership that's about putting people first. And it's about us, not me. And a lot of folks, when they rise up professionally, they can get distant from servant leadership. But in this public sphere, you have to hope that you never lose sight of that.
You can easily get into that sort of transactional leadership or other models of leadership, but being a servant leader, that takes intention, it takes thoughtfulness to make sure we're continuing to think about the community and how we can best serve those and be part of the community. So I really appreciate that.
Great. Now we've talked about servant leadership. What did Dr. Nate Overmire want to be when he grew up?
From a small age, I always wanted to be a physician, and that was part due to my two aunts and my mom, who always wanted something better than the life that they had. All of my family are laborers. They're all worked in the auto industry, so they all went to high school, and then went off to the factory line. And it provided a stable house for us, but they always wanted something better for me. So I can remember from a small age saying, "Hey, you need to be a doctor." And they didn't say, "Nate, you need to be a doctor or a lawyer or a county administrator." They said, "You need to be a doctor." So for some reason, from a small age, they saw something in me that they wanted me to pursue that. And then it did take a moment in college where I was like, am I doing this for them or am I doing it for me? And that was a time where I went to Spain for a semester. I didn't take any biology classes, and I realized how much I missed it. And that those were sort of pre-med focused classes. And I realized, wow, this is stuff that I actually love to learn about. And this is what I want to do with my
You
life.
always wanted to be a doctor.
Yeah.
What age?
Crazy.
What age were you
5.
when you first dissected something that was reported?
No, I was not the kind of kid that would take a frog and dissect. I wasn't that kind of kid. No. High school.
So 10th grade biology.
Yeah, 10th
You
grade
serious?
biology.
You did your first dissection in 10th grade biology, and you wanted to be a doctor. You was talking about your doctor at age 5.
Well,
You had a telescope, little kid thing around your neck.
I had the telescope. I was always wanting to listen to people's hearts and lungs. Yeah, I
Okay.
wasn't the surgical.
When did you
physician.
get your first white coat?
I probably for Halloween one year, I probably dressed up as a doctor once when I was in middle school. So maybe middle school, 6th grade-ish.
You've been in this position, I think a good while now. You've assembled a quality staff. Very professional. You've been nationally recognized already for some of your work. What is your 5-year game plan for the office? Where you want to see the office go? What areas that you want to strengthen? And what areas that you feel like there's opportunities to get better in that you want to improve?
Well, we want to continue to build on some things that we're doing right now really well, which is shadowing opportunities for high school students. And that those may be limited to some tours of our facility, but then shadowing opportunities for the community. Again, that may just be limited to some tours of our facility, but internships for college students who are really interested in forensic science, getting them really excited and engaged in what we do here at the Franklin County Forensic Science Center. So a lot of education with and for the community to get them excited, to get them to demystify some of the things that go on here. And then 5 years out, with your help, we're excited to be partnering with Ohio State to have a forensic pathology fellowship, and that will provide a pipeline of forensic pathologists so that Franklin County will never have a limited amount of pathologists that are doing the statutory duties, but also providing really good postmortem care for our community in Franklin County. So in 5 years, our first forensic pathology fellow probably they probably will not have graduated, but they certainly will have matriculated at that point.
How do we, with Black History Month was last month, this month is Women's History Month, how do we get more inclusiveness in the profession of pathology, medicine, and for that matter of fact, just the sciences in general?
So I think it goes to where people are at right now. So we're actively engaging in high schools and colleges in the area. So our pathologist, our overdose investigator, our suicide investigator, going out and giving talks, presentations to communities, communities of color, communities that may be disadvantaged historically. And so it means going out and actively saying, you are part of the community. We want you to be engaged. We want you to feel welcomed into this family of Franklin County, but also in science, and in particular forensic science. We unfortunately see too many minority populations, too many folks within minority populations dying of overdoses. We especially see Black babies dying at higher rates than their white baby counterparts. So it's saying, hey moms, hey dads, how can we engage with you? How can we partner with you to make your life better, to make the community healthier? And that can mean, is there an opportunity for you, person in the community who may have been in law enforcement, maybe at the age of retirement, but you want to give back So, hey, be an investigator, help, figure out the cause and manner of death of these babies, these overdoses, homicides, and then how can we engage in some of the prevention things that we talked about. So I partner with Columbus Violence Reduction, with Director Robbins, to talk with young Black men and saying, hey, we see that you're on this path that's not sustainable. We don't want you to end up in the morgue. We don't want you to end up jail. We want you safe, alive, and out of prison. So what resources do you need? And how can we partner with you and your family to keep you healthy, to keep you alive? And that may mean, and I'm committed to this, Administrator Wilson, are there roles, are there jobs here at the Franklin County Forensic Science Center that you may be able to apply to right now? Or are there educational opportunities and training pathways so that we can get you into an investigator role, into a forensic pathology role? Do you want to be a physician, a young 20-year-old person, or hey, 15-year-old, someone at Whitehall or Reynoldsburg High School or in Columbus City Schools? How do we talk to you in a way that engages you and excites you about forensic science, and that maybe in 8-10 years, you are a forensic pathologist in Franklin County?
That leads me to the next question. What is, what are entry level type positions you may have there, but may require as little as an associate degree or less than that, or
Less than
everything?
We have morgue attendant positions. We have 4 of those. Those folks are in charge of receiving and releasing bodies, and you only have to have a high school diploma. Now, you may think, oh, receiving and releasing bodies, that's an unimportant role. But let me tell you this, Administrator Wilson, the first time that we release a body that's not the right body, and that body gets cremated, I'm going to be on the news and I might lose my job. So that person is critically important to the structure and the roles that we have here. And yes, you only need a high school diploma to say, this is John Doe or this is Jane Smith. And we got to make sure Jane Smith is being released to the right funeral home so that she can get cremated or buried in the proper way, so that we're interacting with the funeral homes in a timely and thoughtful, intentional manner. Because if you're of the Muslim faith or of the Jewish faith, there are timelines after death. And we want to be thoughtful and intentional about the way we're doing business here so that we can honor someone's death and their wishes after death, so that someone of the Muslim faith can be buried. We try our best so that they can have their burial practices within the 24 hours like their religion dictates. And so being a morgue attendant, you have to kind of be, even though you only need a high school diploma, it's a very important role. Mm-hmm. Same thing goes for a case secretary. Those folks are doing some of the clerical work, inputting the data, doing some quality assurance checks, to making sure John Smith, Jane Doe are being inputted in the right clerical manner, so that when I get these reports, everything's lined up for me. I spend about an hour every day reviewing these reports and then signing my signature, but that also is an entry-level position. Super important, because if some of the things aren't accurate and I'm reading the wrong things on the wrong person, that's an issue.
Okay.
Really important stuff.
What would surprise people most about the operations here at the Franklin County Forensic Center?
So that's a great question, Administrator Wilson, about surprises that the community may not be aware of. That pathologists, number one, are hard to come by. There's only 600 of these pathologists in the nation. We have 8 of them, so we're really blessed. But we need about 1,000 forensic pathologists in the entire United States. We only have 600, so there's a gap in the services that could be provided. But thankfully, in Franklin County, we're well staffed. Something else that might surprise folks in Franklin County is that we're not a viewing facility, and that's a pain point that we often get with the community. Is that mom or dad may want to see their loved one, see their baby in our facility and identify them, but we often use scientific means of identification: DNA, fingerprints, dental, radiography. So we often don't need someone to identify someone via, and this is the classic, pulling the screen back in the movies and saying, "Yep, that's my boy."
Yeah,
we don't do that here 99% of the time. And in the times that we do need a visual identification, we use a photograph, and so people feel a sense of like, oh, you're not allowing me to be with my loved one. But the time to be with your loved one is at the funeral home. Let us do the important work of determining cause and manner of death in the highest manner of dignity and respect for the loved one, but let us do our job as quickly and accurately as possible so that we can get your loved one to the funeral home. Another surprise that, or a misconception that the community may not know, is that we do not determine guilt. We're not law enforcement, but thankfully we are an independent agency from law enforcement. We need law enforcement. We need their work that they do in the community. It's really important. Just like we need EMS, fire, we need all of their reports to come to us so that, because we're not investigating the entire scene, we're just investigating the body, but we need all of their reports so that we can finish our report. And so sometimes when it takes 2, 4, 8 weeks, sometimes that's what we're waiting for. Sometimes we're waiting for toxicology. Sometimes we're waiting for histology. We have a lot of different stakeholders that we're working with. And that's sometimes why it takes a month or 2 months. Rarely does it ever take now in 2025 more than 2 months for an autopsy or a coroner report to be finalized, which I'm really proud of. There was a point where it's taking a lot longer than that due to the lack of pathologists and lack of staff here. But with your support and assistance and the county's support, we've sort of shored up our staff here so that we can be both accurate and timely, because people are relying on insurance money from the decedent's estates and so many other things. So we want to be timely.
So I mean, there's a lot of technology in this facility. Sure, you all go through a lot of chemicals and for the research, but your top expenditure is people. Am I correct in that?
Yes, sir.
And it's because of how long you talked about pathologists and the amount of time they spend preparing and receiving all of the certifications and everything that they need to be on top of their profession.
There's some days.
There's a scarcity. There's a market scarcity.
Yeah, there are some days where I'll look at a coroner report and I'll see their findings and I'll be like, oh, I learned about that in med school. Because as a family doctor, I don't see some of these, strange or rare disease states or like a lesion that, oh, I did learn about that in med school. But some days I'm reminded how much expertise and how much it takes to know what they know, and how much training, how much education, and so they are the experts. And I'm really happy that we've taken the investment that we have to invest in these important people.
How would the Franklin County Coroner's Office measure up size-wise compared to other metropolitan counties?
We're the biggest in Ohio, I believe, save for Montgomery County, but Montgomery County takes a lot of out-of-county cases. So of there, I think Montgomery has 10 or 11 pathologists, which actually might surprise you. A county the size with Dayton in it should have half as much as us, right? But they have a little bit more than us because they take, half of the state. Most of Western Ohio counties that need an autopsy go to them, whereas we just take Franklin County cases. Hopefully with our ninth pathologist, we can have a discussion about taking out of county cases, if that's appropriate. But we measure about the same as Cuyahoga and Hamilton. So Cincinnati and Cleveland, we're about the same.
Okay. Is it common for coroners to be doctors? Is that when you go to national conferences, is that the standard that most have to be a doctor of some type?
In Ohio, the coroner has to be a physician, but actually in the United States, there's only 14 states that have coroner systems. The other 22 have medical examiner systems, and the other 14 have a hybrid. So actually, we're technically a hybrid, since Cuyahoga County and Summit County, they have medical examiners. So their top coroner person is a forensic pathologist who's not elected. It's appointed by someone like you. And so they're not directly responsible. They can't be held accountable directly from the people like I am. They would hold you accountable for the medical examiner's issues that they would have. And so when I go to conferences, it's a weird split. I'm always like, where are you from? What state are you from? Oh, you're a medical examiner, or you're a coroner. And like for example, in West Virginia, the coroners don't need to be a physician, which kind of makes sense since West Virginia has such a scarcity of physicians already. It'd be really challenging for their county, each county, to have a coroner who is a physician.
In Franklin County, we put a great emphasis on employee wellness, and I thrive on benefits plan. And we zero in on certain professions that put a lot of stress on our employees, and it causes, when you're doing tough work, time and time, over and over again, repetitively, it can put your mental well-being at stake, and then your mental well-being is tied to your physical well-being. It's a circular thing. What are some of the things that you do here in this office to help employees given the type of work that they do?
Well, we're so grateful that the county is so generous in the resources and the support that they give all of us employees. And I make sure I tell everyone we are constantly being inundated with trauma. The pathologists and the morgue technicians, they have to cut on people every day. And that might not be traumatic because that's their job. But at some point, especially with some cases, the things that really bother me are teenagers that die by suicide. Those really, those choke me up a lot. Kiddos, when we see a baby once a week, and that's not normal. It's normal for us in a sense that that's kind of our standard of work, but at some point it's going to take its toll on someone. And so I really recommend every employee, whether you're a pathologist or a case secretary or a chief of staff, to make sure you're taking good care of your mental health and your physical health. So I encourage people, hey, from a physical health standpoint, are you exercising? Are you eating right? And are you getting enough sleep? But all those things contribute to our mental health. But the county has amazing resources from a mental health standpoint. But we also have a canine unit that comes from the sheriff's office. So some puppy love that can help, increase morale.
Therapy pets.
Therapy pets, yep. But we also, as a staff, as a leadership staff, try to make sure we're being thoughtful and intentional about having, cookouts in the summer for staff, or other ways that we give back our time and energy so that they know that they're cared for, that we are a team, we're almost like a family, and family has to take care of each other.
Community outreach, reaching the public and getting them to understand what you do, why you do it, particularly when you're supported by the taxpayers is important. What are some of your key community outreach and civic engagement strategies?
So that's a great question, Administrator Wilson. We have a whole lot of outreach from our overdose investigator and our suicide investigator. In particular, our overdose investigator is starting to go out to high schools and talk to them about preventing overdoses and the disease of addiction. So that can be really beneficial to students who may have seen something in their community, may be experiencing that within their family or within themselves. And it's an opportunity for us to reach out and connect people to resources. We are so resource wealthy here in Franklin County, but sometimes connection poor. So I feel like we can be Switzerland and connect people to different resources in the community. Then I'm going out partnering with, for example, Mothers of Murdered Columbus Children, doing some advocacy on their behalf, talking about how we want to prevent homicides and we don't want to see any more children, or any more adults for that matter, dying at the death by the hands of another in our community. But we talked about engaging and exciting the next generation of forensic pathologists. So it's me going out to COSI and talking about what I do and talking to students who are really interested about forensic science and saying, hey, you have a place here at the Forensic Science Center. This is where you could have a job and make a decent amount of money, have great benefits by working at Franklin County and tying into all the other agencies and many other opportunities in our community. So there's a lot that we're doing in terms of outreach. Just this weekend, I did a presentation at a church. And so it's reaching out to the faith community, talking about misconceptions there may be in the community, but also educating about what we do here so that we can demystify, but also engage, excite that next generation of forensic pathologists and other workers in our community.
When you go to conferences amongst your peers, what's the profile? Median age is such. I bet you kind of like stand out
a little bit, yeah.
That's a good thing in my opinion, but I know you kind of stand out.
But there are younger forensic pathologists who are just out of fellowship that are my age or younger. So that's nice to have that sort of.
Yeah, but you the man in charge here. You the man in charge. You ain't just out of school. You like.
There is one
man.
Younger-ish coroner in Ohio. He's in his 40s, but for the most part, classically speaking, coroners get a bad rap for being like a retirement age job. Like, all right, you're in your 60s or 70s, you're gonna right off in the sunset on a easy job. But this is not an easy. I don't view this as an easy job. I view it as an opportunity to really engage, advocate, have an impact in my community, so that we're seeing less people dying of overdoses, less people dying of suicide, homicide, all these manners of death that are. It's tragic for someone, for a family, and for a community. It's a huge cost when someone dies at the hands of another. Just recently I went to a summit that was hosted by Columbus Police and the community, and it's millions of dollars that's spent through the justice system, through our office, when these deaths happen. So if we can prevent them, we're saving the taxpayer a lot of money.
Yeah.
And all the trauma associated with that. When I go out to these scenes of decedents and I see their families in that initial shock, it's so much trauma that they're going through then and there, but that's going to last for days, weeks, months, years. And I've talked to many families who've said, Dr. Overmire, when I found my son, for example, with a gunshot wound to his head, years later, I thought about taking my own life because of how hard it was to grieve. And some people follow through on that. Thankfully, that doesn't happen as often as, but there's just so much trauma. So if we can prevent that, and I see this as a very serious role to help prevent that in our community.
How did your office coordinate with Lifeline for the organ donation and all that? How did all that?
So we have a good relationship with Lifeline of Ohio, the organ and tissue procurement organization within Central Ohio region. There are cases where we restrict access on, for example, most homicides. We don't want organs or tissues going if it's going to affect a case. But we want to allow tissue donation and organ donation to folks in need as much as possible. So we work closely with them to make sure we have appropriate guidelines and restrictions in place to keep the decedent, to allow us to provide justice to the decedent. But we also want, life-saving organs and tissue to go to others in our community. So we work closely with them to make sure we provide appropriate guidance. We did get an award last year from Lifeline of Ohio because of our dedication of working with them so closely. We developed some logistical and operational aspects within our data system to help streamline some of those access points. And so access and time is of the essence, literally, within these cases. So if we can streamline processes and operations so that we can say yes or no to a donation or not, and if that yes can happen quickly, and that they can get life-saving organs and tissues to people who need it, then that's a win for us, right?
Right. Growth. Franklin County is the largest county in the state of Ohio. 1.4 million people and growing. And I'm sure you get the population estimates from the Mid-Ohio Regional Planning Commission, and know that, just over the next 6 years or so, we probably will be approaching 2 million people. How does this office project for that, and what does you see for the future of this office to keep pace? Because your office quite naturally will be affected by that growth.
And that's such a good question. We are just right now formulating our 4-year strategic plan, thinking about population growth and what the community and the county needs, but also what our own office needs. And then taking that strategy, looking at what are the gaps, what are the needs, and then going to folks like you and the commissioners saying, here are some opportunities because of this potential growth and the perceived growth. Do we need more pathologists? I think thankfully right now, Administrator Wilson, we're good on that for now and for the coming future. But as we plan and continue to grow from, if what you're saying is 1.2, 1.3 to 2 million in the next several years, that's inevitably going to have more deaths. Like, yes, I would love for the number of deaths to go down. And we are seeing a good trend in that way in terms of overdoses. But as population continues to grow, as our county grows, you're inevitably going to have more deaths that are going to come to this office. And so it's, taking our numbers, taking the data, looking at it closely, broadly, but also with the fine-tooth comb and saying, hey, what are some of the needs? What are our projections? And then the county so far has been very generous and very supportive of our needs, making sure that we're being accurate, timely, and compassionate with the care that we're providing the county. And so we want to just continue to do that.
Is there any legislation out there that could impact the burdens on county coroners here in Ohio? Is there any legislation to increase the number of instances where autopsy is mandated? Are there
Thankfully not that. No, thankfully no.
So is there any legislation you're aware of? And I guess that leads to the question, there's a great focus on Washington right now. And federal funds are being reduced in all kinds of areas. Are there any areas of your budget here that makes the Franklin County Coroner's Office and the Forensic Science Center run that could be adversely impacted by federal action?
Our overdose investigator in particular is 100% grant funded. And when we learned that some grants were being cut off right then and there, we were like, what are we going to do with this? Now, thankfully, there's been a sort of a lifeline.
Judicial interjection.
Correct. So that position is safe for now, but in general, both business and government like stability, and we have so much instability coming out of Washington. It's a little, not a little alarming. It's quite alarming, and because we're mostly taxpayer funded, the amount of policies that Washington and the federal government put on the states and on local government is concerning. And so we certainly continue to monitor both local, state, and federal policies and procedures that may impact our day-to-day operations, but also our strategic goals and values.
Thank you. As we wrap up the podcast, I want to lighten things up a little bit, like I always do. In your work, we know it's you talked about the stress. You talked about your focus on our residents and ensuring that you give them the best service possible. How do you balance that? What does Dr. Overmire like to do for fun?
Well, I love going to crew games and Blue Jackets games. We just had a tie this past weekend, so I was a little upset about that. But our opening was amazing. So if you're a crew fan out there, I usually stand in the Nordeca section and root on my crew. That's like the
in the Nordeck.
I'm on the Nordeck, Mr. Wilson.
Anybody know anything about Crew SC? The county coroner, Dr. Overmire's in the Nordeck. So you got an edge to you just alone. We're gonna say that. They had the bravery.
It's fun.
It's so narrow though.
It's exciting. I love it. It's amazing.
You don't get the urge that you're just gonna fall like forward, like over.
There's a railing. There's protective barriers.
Podcasters, if you gotta see, you Google it, look up the Nordeck, and you'll know what I'm talking about. You'll feel like you're going. It's the narrowest place, but it's the
It's
equivalent.
steep. Yes,
It's the soccer equivalent
roads are
of the
steep.
dog pound.
we're rowdy. We can be.
It's the soccer equivalent.
When the ref
Can
makes
be.
a bad decision,
Can
we're
be
gonna on
rowdy. I don't never look over at the Nordeck and it's not rowdy. I'm too conservative to be in the Nordeck myself.
So that's when I'm able to yell and get my frustration out, Administrator Wilson.
See, I might get in trouble if I was in the Nordeck, so I can't go over there. I can look over there. But now I'm gonna know you over
I
there.
could probably get in trouble by something.
Now I'm gonna know you over there. I'm like, so over there.
Now, great. Someone's going to pick me out and put a camera on me the entire time.
No.
And get me in trouble.
Our viewership is not up to high enough. Don't worry about it too much. Don't worry about it too much. Don't worry about it. Okay, we're gonna move on. Beach or mountains?
Beach.
Where at? Atlantic, Pacific, don't matter.
Caribbean.
Caribbean.
Puerto Rico.
Okay.
Venga.
Okay. All right. What you like to do? What you like? What's cool about the Caribbean you like most? Because that's it. That's more than just beach. There's a lot of other stuff there.
So I love Puerto Rico because there's not only beach, but there's
You like
amazing food. I like the music. I love the culture. The dancing. Oh, I love it. It's all amazing. But
You didn't say that. You didn't say birds, so that is not why you're there for the colorful birds.
I don't know what it means.
Are you a nature guy?
Oh yes, I love birds.
Okay.
Yes, I'm an ornithologist.
Now we're gonna skip to you like the Buckeyes. I know you like the Buckeyes, don't you?
Yep.
But that's what
But you know I'm a bobcat.
I am
Bobcat.
too. I'm
Are
a
you?
Bobcat, yeah. Forever Ohio.
What?
Oh, yeah, all of that.
Okay, so we're both bobcats and bobcats. All right.
I went there for grad school. I don't know if that don't count the same though. 'Cause
So did I.
I was hiding during Halloween as a graduate student, wanting it to end. Looking through my blinds like, when did it end? When is it over yet? So, I gotta realize I don't have as much credibility as an OU graduate because I'm a grad school graduate and not undergrad.
I feel the same way. I feel like my credibility is a little less, right? Because
Because
I didn't have that college.
wild things happened on the Hawkins, Harvard on the Hawkins. Wild things happened around Halloween. Oh, it could just be any given weekend based on my observation.
First Street
Just
can
could
get
be
wild
any
any weekend. Yeah.
given weekend.
We love that. We love people having a little fun, expressing themselves and getting off some steam or just
Well, you a burrito buggy guy?
Mama, Big Mama's burrito. Yeah, I love Big Mama's.
They had a lot of different food was good.
Mm-hmm.
I
I studied all the time, though, Administrator Wilson. I studied. It's just study.
I believe that. Now we're gonna skip on to professional football. Which team you root for?
I think you know that I'm a huge San Francisco 49ers fan.
I just want you to repeat it. So give us some background on why the 49ers.
So my grandma used to live in San Francisco, and I visited her in 1990, the last year we won the Super Bowl. I don't know. Has your team
1999. It's a long time.
1990?
1990.
90.
90. Oof. Yeah, it's been a while.
It's been a minute, but when was
I
the last
know,
time
wait,
your-
where you
when was the
going
last time your
next?
team won?
They haven't won.
That's what I thought.
But they ain't won. Now
I'm looking forward to a great year. Brock Purdy's hopefully gonna get paid. Now we just lost Debo. He's such he has such versatileness to it.
yes,
Just
yes.
big.
Great.
He's a thick, just big guy, yet fast. So I'm sad that we lost him, but I'm hopeful we're gonna pick up some new additions with the draft and continue to utilize our skill players in the best way.
What else do you want to share before we conclude this podcast, Dr. Nate? Anything else you want to share? Anything else you want to put out there? This is your time for your public service announcement.
So a few things I want to make sure I mention. Coming up later this month, Administrator Wilson, we are having our art grand opening. And you may think, what? Art opening in the Forensic Science Center? But we are having a destigmatizing event when it comes to overdose awareness. Folks who are struggling with the disease of addiction and folks who are in recovery from their disease sometimes utilize this outlet of art. And so we want to assist and uplift those people who are in active recovery and showcase their work, because we're so fortunate to visit some sites who are working with folks who are in the recovery process, and some of them are utilizing art, paintings, other forms of art to express their disease process or help something that's helped them through recovery. And so we are having an event showcasing some of that work and showcasing the work that they're doing in treatment and in recovery, staying alive and contributing back to society, contributing back to our community. So we're really excited about that. That event is coming up March 27th at our facility in the evening, and there's lots of brochures going out about that. Administrator Wilson, so we're having a Black Male Behavioral Health Symposium talking about Black male mental health.
It's a big issue.
It's a big issue.
We have a Soul Talks initiative that is very similar to that.
And so I don't know if you know this, but the person who has most at risk for an overdose in Franklin County is a Black man aged about 50. That's the person with the highest risk.
Mm-hmm.
And so how do we get that particular population to talk about their mental health, to talk about their disease of addiction, and how do we partner with organizations that are working in that space?
You're having a middle age crisis to the level that you want to take your life. But there's a lot that leads up to that. A lot of pain, a lot of disappointment, a lot of traumatic experiences that lead one to about that when they get to that point. And then on the other end of the spectrum, what also troubles me is, kids age 8 to 13, that being the leading cause of death for that group, just like blows my mind.
And in the same vein, so we're partnering with the Columbus and Franklin County Addiction Plan, and we host the annual Overdose Awareness event. International Overdose Awareness Day is always August 31st. So we try to have an event around that day to symbolize the work that's being done in the space, to recognize the work and uplift those who are struggling.
Do you do any we touched on outreach, but just looking around at the facility, have you all done any community open houses? Let people see, of course not restricted areas, but just to see their tax dollars at work and to see the lab and to see everything we do. Because I want to bring more exposure to you. I think you're underexposed. You need to bring more exposure to Dr. Overmire. Because I expect you to be county coroner for a very, very, very long time. So we need the community to know who you are and raise your profile.
Well, I appreciate that.
No, our Dr. B at COSI, he's an award-winning podcast, the Grammy Awards. He can have a Dr. O. Yeah, we got to give you something unique, but you're underexposed, and I could tell you got to come out more. You look good. You got to come out more.
Thank you.
You got to come out more and let them know who you are and what you're doing. There's only one Franklin County coroner, and it's you. It's you. So you need to get out there. You need to get your public affairs staff. I know a few folks that work for you that I'm gonna have to get them to get to working and get you more exposed. I know them a little bit. I know a little while. I know a few of your folks. They're pretty good too. They just need a little push. They just need a little motivation.
Well, I think we're doing a lot. I appreciate that statement that we're underexposed, but we're being thoughtful and methodical about bringing folks into the facility. Citizens Academy sort of folks who are interested in the work, but also folks who have had a loved one die and we want to demystify like what has gone on. We have brought folks into our facility, but we can think about appropriate ways to open up art and give some tours.
Because it's like having to go to court. You only see the court when something bad happens. You see that's where you reflect it. Coming here, to see it in before something like that you ever happen. I think many people go through life and never even have to drive by here, but it serves an important governmental function.
It sure does.
I appreciate you. You could have done many other things other than become county coroner. So that's why I'm an advocate for you to have a long tenure here. You can just be the family physician. You can be a family physician. You can do that. That's probably I won't quote the number, but you might have to be at age. You got a lot of upside. I tell you got a lot of upside. We're gonna magnify all of that. So,
thank you.
It's great. Thank you for taking the time for being on this podcast. This is another episode of having the opportunity to bring community champions on the podcast and talk about the work they do.
Thank you for highlighting our important work and the public service that we're doing. It's really important. Thank you.
One more time, you got a book. You got a book. You got a digital music favorite. You got what one else you want to say? Why the mic's on?
My favorite book is The Sun Also Rises by Ernest Hemingway. No.
Okay.
Is that a good answer? I don't know, Columbus. You tell me.
People will look it up and see. Well, we've concluded this podcast. It's been an enjoyable conversation with Dr. Nate Overmire. And as I always end by saying, do you, because nobody else has time to.